the JAMA Network.
My name is Dr. Christiane Rumi. I'm an associate professor of internal medicine and pediatrics at Vanderbilt University and a physician at the Tennessee Valley Healthcare System, VA, in Nashville, Tennessee. The American Diabetes Association recommends that when patients are diagnosed with diabetes, they start on diet, exercise, and metformin as first-line therapy. If patients do not reach their hemoglobin A1C goals, then typically they need a second medication added. Our study looked at the association between metformin with sulfonylurea versus metformin plus insulin on cardiovascular disease and all-cause mortality. We have a national cohort of veterans who received care at the VA between 2001 and 2008 and started treatment for their diabetes with metformin. Patients were about 60 years old. Approximately 35% of them had a past medical history of cardiovascular disease or stroke. Most of them had been on metformin for an average of about 14 months. So we ended up with a little under 2,500 metformin plus insulin users, propensity score matched, to a little more than 12,000 metformin plus sulfonylurea users. All of these patients were followed over time to look for the development of the composite outcome, which was hospitalization for heart attack, stroke, or death from any cause. We found a 30% increased risk for the composite outcome of hospitalization for heart attack, stroke, or all-cause mortality among patients who were given metformin plus insulin compared to metformin plus sulfonylurea. But there was no difference in the rate of heart attack and stroke hospitalization. Most of the risk came with an increased risk for all-cause mortality. In conclusion, we feel that adding insulin is a reasonable option for patients who desire fast or flexible blood sugar control. However, there's no advantage on cardiovascular disease for adding insulin early. And we feel that most patients could be managed with a sulfonylurea as the second-line therapy. Some of our next steps are understanding why there is this increased risk of death among patients who use insulin. There have been multiple hypotheses that it is hypoglycemia or variation in blood glucose, and we are setting out to understand the relationship between insulin and hypoglycemia and how that may impact the risk of death.